Welcome to the Center for Opioid Research, Education, and Outreach webinar series. This program is made possible by a grant from the Alabama Department of Public Health in cooperation with the Centers for Disease Control and Prevention.
Okay, we're going to continue our conversation with step 2, and that's expressing your concerns and being direct. And you really want to ask how they're feeling and state your reason for concern. And you want to say what you mean. So you want to do things like you want to recognize what the problem is and your concerns about it and their intention to change. People are not going to change until they're ready. And so this is an important first conversation. They may be ready to change, they may not be ready to change. But it's still helpful to have the conversation. When you use questions, you want to use open-ended questions, and you may start with what, how, why, when. And so I've got some examples of how you might have that conversation. For example, can you tell me about your current opioid use, and how might you be affected by either drugs or alcohol? And so this gives you an example of how you can run a conversation. In addition, you may want to discuss your own family history if it's relevant. So if you have a past history of using drugs or alcohol yourself, you may be able to share that if it's relevant to the situation. Again, you might remain judgment-free, show respect to the patient, and share where your conclusions came from, but don't present your conclusion as the truth. And you don't want to exaggerate by using terms like always and never. Step 3 is to acknowledge the individual's feelings and listen. And again, listening is really important. You want to reflect what the speaker is saying. In other words, to clarify the understanding. So you want to, when somebody tells you something like, I've been under a lot of stress and I feel like I need to use this particular drug to help me function, you want to say back to that person, so it sounds like you really need this medicine in order to function properly. So you want to summarize it and bring a new interpretation, and that really helps the person understand that you're listening carefully. It also allows you to check your understanding so that the person can come back, that you're talking to can come back and say, yes, that's exactly how I feel, or no, that's not how I feel, this is how I feel. You want to make sure you're managing your internal voice because, again, sometimes you're not agreeing with that person, so you want to manage that because it's not about you, it's about them. You don't want to make statements that are disguised as questions or cross-examine. Always start with open-ended questions, and then you can narrow down your questions like a funnel to get more specific information, but always start with open-ended questions. And you also want to make it safe for that person to give you information. Some verbal skills that you can use is to ask questions that show you care. Make sure you restate what you've said. You can summarize their facts and feelings, and listen and watch for nonverbal cues. That can tell you a lot, and sometimes those verbal cues may be different from what the individual is saying. You want to be patient. Don't get frustrated. Avoid giving unhelpful advice and try not to interrupt the individual, especially to share your own opinion or experience. And remember that silence really is okay. For step 4, you want to offer to help. You can provide accurate information on the course of the drug misuse. You can provide advice about the risks associated with the situation that the individual's in. For example, they're smoking or they're drinking or using drugs. And you want to, again, explore their readiness for change because nothing is going to change until the individual is ready for change. And so there's several levels somebody has to go through. They have to realize there's a problem, they have to consider making that change, and then usually something has to occur for them to be ready to make the change. And so you want to explore where they are in that. And then you want to involve the person who's using the substance in the plan for managing the problem itself. You can use a frames approach, and that's feedback about their personal risk or their personal impairment. Responsibility emphasizes their personal responsibility to change their behavior. You can give advice about cutting down or abstaining because of their dependence or harm to themselves. And then you may give a menu of different options for changing their pattern and set a target date. So oftentimes we'll say, we'll start next month, or we'll start on the first day of the month or the last day of the month. So find a date when you can start reducing usage. Again, be empathetic and use a self-efficacy interviewing style, and that helps the person to feel like they can actually change, that they can do it. You want to let them know that people do recover and support can make all the difference, and your support can really help them. If you need help, you can call this number, the 1-800-662-HELP, and they can help you and can provide you with a treatment referral. Step 5 is just to be patient. And there's things that we want to tell the individual experiencing the addiction or misuse problem. You want to acknowledge that the individual is dealing with an addiction. And if you're angry, you're not angry at them, you're angry at the disease. And you're willing to support the individual in their addiction and for them to get better. Some things that the individual wants you to know is that your love is not enough to heal their addiction. This is a disease and it's very difficult to treat. They want you to know that they're not choosing the drug over you. And they want you to know that they want to quit. It's just very, very difficult. Things that aren't supportive is telling the person to get better or being sarcastic. You don't want to be overprotective, or you don't want to nag the person. You don't want to trivialize their experience or belittle them. And you want to avoid being patronizing, and you also want to avoid wanting to cure that individual. Some additional hints and tips are to introduce questions in a very sensitive manner. Be direct. Ask what you want to ask. Don't try to beat around the bush. Again, you want to convey empathy, respect, and be non-judgmental. And you don't want to make assumptions based on things that are pertinent to the patient. You want to identify appropriately to any of the nonverbal cues that they express. And you may want to use questions to find out how they feel, something that might have an emotional focus, find out how they're feeling about their usage. You also may want to elicit and respond to concerns about their physical and their mental health. And then you can identify and respond appropriately to difficult emotions that they're having. Then reflect and summarize the meeting. Here are some pertinent resources. Here's the SAMHSA Helpline, the Alabama Department of Mental Health, and the Recovery Organization of Support Specialists. And all of these can either help you with your communications or provide information on other people that can help to support you. And this is just a list of references that you might be able to use. Ending there, thank you so much for your attention today. I hope this is helpful to you, and I appreciate your attention. Thank you.